A study from the Perelman School of Medicine at the University of Pennsylvania indicates that younger patients, or those who haven't used opioid pain medication before, are more likely to not need any opioids after common surgeries. The study, published in Annals of Surgery Open, used automated text messages to collect data from approximately 3,600 patients who had undergone 30 of the most common surgical procedures. The researchers found that understanding a patient's history with opioids and their pain levels upon leaving the hospital could help tailor prescription pain medicines and reduce the risk of leftover opioids after surgery. The study suggests that these patient-informed moments could be used to help manage pain, tailor prescribing, and support clinicians in balancing the risks of opioids while addressing expected post-surgery pain.
If you enjoyed this video, please give it a thumbs up and subscribe to my channel for more great content.